Well, next tonight, it is the long-awaited news school districts have been waiting for. The Center for Disease Control issuing new guidelines for the in-person learning. The CDC recommending now schools can go from 6 feet of social distancing to 3 feet in a classroom, but students must remain masked. But now school districts are waiting for the state health department to approve these new recommendations. 7 Eyewitness News senior reporter Eileen Buckley tonight has reaction.
We're excited to hear that the CDC has adjusted their guidance as far as in-person instruction goes for school districts.
Here in the Alden Central School District, Superintendent Adam Stoltman says they've been working for the last 3 weeks on a plan to switch classrooms from 6 feet to 3 feet apart.
We're ready to go. We can bring all of our students that are interested in 100% in-person learning.
In this Alden High School classroom, the desks are 6 feet apart, but with the change, it'll look more like this.
But districts cannot make any changes unless the New York State Health Department gives them the green light.
I believe on February 25th, Dr. Zucker indicated that in the next 48 to 72 hours, we'd be hearing something. And here we are, March 19th or 20th, and we've yet to hear anything.
The CDC is now recommending that 3 feet spacing in the middle and high schools can only happen if there is not a high level of community spread. The average positivity rate in the entire Western New York region Thursday was 2.1%.
It's unfortunate and disheartening that they're tying the guidance to community transmission rates.
Taria Parsonen and Amy Leach are Clarence school parents and with Western New York Student First. The group is pushing hard for full 5-day-a-week in-person learning.
We're still waiting. We're still on pins and needles to figure out what happens, especially for our kids' mental health.
Both parents say they are excited the CDC is offering this new guidance, but say it's not enough to quickly return students to school full-time.
Nothing's really changed yet. We need to keep up the advocacy and the pressure.
As much as we're all excited about this, I still feel that we are at a standstill.
The organization has repeatedly called on the Erie County Health Department to make change and allow students back in classrooms.
So I know you keep referring to Erie County, but they are telling us otherwise.
I'm glad you brought that up because that's what we had been believing as well. But it's interesting to see other counties act separately and independently.
Earlier this week, Erie County Health Commissioner Dr. Gail Burstein said the county relies on the CDC and state for the guidelines.
We've told the schools that our county attorney has advised us that local health departments in New York State are not allowed to develop policies for the schools.
The county issued a statement saying Erie County falls within the high transmission category. And it states, if New York State decides that schools can implement these new recommendations, middle and high schools in areas with high transmissions should still follow the 6-foot guidance. The state health department tells me they are reviewing the new CDC guidance. Eileen Buckley, 7 Eyewitness News.